Okay, for this video, I'm going to be showing how to assess for like the sounds of the heart on your patient. You want to start, wash your hands, make sure you're ready, make sure your patient's ready, and then you're going to begin by looking for any obvious deformity like a caved-in chest or an expanded chest. You want to look for any swelling, discoloration, bleeding. And so to start, we're going to do the aortic valve area. To do this, you want to make sure you have your stethoscope on, and you're going to palpate from the collarbone and move to the second intercostal space. Okay, and then once you're there, you want to hold your diaphragm with 2 fingers. And listen. Okay, after that, you're going to keep this space and you're going to move over, just walk over with your fingers to the second intercostal space on your patient's left side. And you're going to listen there with your diaphragm. This is the pulmonic valve area. Okay, once that sounds good, next you're going to move to the third intercostal space. And this is Erb's point. Okay, sounds good. From there you're going to move to the fourth space, and this is the tricuspid valve area. And from here, you're going to move to the fifth intercostal space, which is the mitral valve area. So you'll just palpate underneath. Make sure the diaphragm's flat. And I can hear it, it sounds good. So then I'm going to go back and I'm going to use the bell side of the stethoscope, and I'm going to listen again, same spots. Okay, for the bell you can use lighter pressure. I'm going to walk over, pulmonic. I'm going to move down, Erb's. I'll go to the fourth space. And finally, the fifth. Okay, he sounds good. Next, I am going to be doing the artery, the carotid artery. For this, I'm going to switch back to my diaphragm. I'm going to locate where it's at. I'm going to make sure my diaphragm head is flat and listen for that, and then I can also listen to it with my bell. It's harder to hear with that, but yep, and he's all good, and then that's it.